Hi, my name is Harmony Gates. I am doing an assignment in 4400, and this assignment is called Vulnerable Population Health Concerns. I chose to do eating disorders. Okay, so according to Doust, eating disorders are a group of psychiatric illnesses where patients have abnormal eating patterns that have a negative impact to their health. Patients typically have an extreme preoccupation with food and their weight. The main characteristics associated with eating disorders are changes in eating behavior with extreme dieting, skipping meals, self-induced vomiting, excessive exercise, overeating, binge eating, restriction of food, overeating, misuse of laxatives, and diuretics for the purpose of maintaining or reducing their body weight. So this population is vulnerable for increased health disparity because of these things. The most common eating disorders are anorexia, bulimia, and compulsive eating disorder. With anorexia, these people refuse to eat or they limit their food. Bulimia, they allow themselves to eat the food but will purge or regurgitate the food from their bodies. And with compulsive eating disorder or binge eating, people eat uncontrollably and gain large amounts of weight. For the size of the population, statewide, in 2011 and 2013, 4% of female students and 1.4% of male students in grades 9 through 12 in Utah public schools met a threshold for underweight, combined with eating disorder behaviors totaling more than 1,000 boys and nearly 3,000 girls in the state. Nationally, at least 30 million people of all ages and genders suffer from an eating disorder in the U.S. 0.9% of American women suffer from anorexia in their lifetime. 1.5% of American women suffer from bulimia nervosa in their lifetime, and 2.8% American adults suffer from binge eating disorder in their lifetime. Internationally, the prevalence of eating disorders is rising in many countries, with the highest rate in Western cultures. For example, Western countries have 6.1-fold higher rate than Asian countries. Eating disorders are typically higher in young females and high-income countries. The rate of eating disorders in Utah is higher than the national numbers. Some contributing factors are the nature of our social interactions and relationships, resources for help in our homes, neighborhoods, and communities, federal, state, and local level partners in treating eating disorders, and the social norms and attitudes. People have more pressure to be skinny and healthy. Social influences can exacerbate that pressure if comments are made that make a person feel their body weight is not ideal. There's not a lot of knowledge resources in the communities or at federal, state, and local levels to help individuals with eating disorders. And understanding and knowing how to treat eating disorders is a developing science. For psychosocial concerns, many people with eating disorders can develop psychosocial problems such as anxiety, depression, obsessive-compulsive disorder, post-traumatic stress disorder. Some social and relationship problems occur, and work and social issues as well. Economic concerns. A study done in Austria showed that bulimia nervosa was associated with the highest total mean expenditure for 3 months, measured in terms of out-of-pocket expenditure, household economic hardship, and cost-related non-adherence. Economic hardship was reported in 96.7% of participants, and 17.8% reported cost-related non-adherence, especially those diagnosed for a longer period of time. There's a limited availability of specialists in hospital systems, forcing individuals to seek private treatment, and this causes an increase in their out-of-pocket expenses. In the private hospital sector, the treatment of an episode of anorexia is second to the cost of cardiac artery bypass surgery. Individuals and families involved in the care of a person with an eating disorder struggle with employment, education, and social engagement themselves. There are many physical concerns of eating disorders, so I'll go through the major systems. We have slower digestion, nausea and vomiting, blood sugar fluctuations, blocked intestines from constipation, bacterial infections, and then the use of laxative cause dependency on them to have a bowel movement. Binge eating can cause their stomach to rupture, and vomiting wears down the esophagus and can cause it to rupture. For neurological, extreme hunger or fullness can create difficulties falling asleep. There's numbness and tingling in the hands from reduced fatty layer on the brain, seizures and muscle cramps from electrolyte imbalances, fainting and dizziness, sleep apnea with the higher weight individuals. For endocrine, you have hormones that fail without enough fat and cholesterol. Lower sex hormones can cause significant increases in bone loss and a risk of broken bones and fractures. Low thyroid hormones, menstrual problems, binge eating can cause insulin resistance, which can lead to type 2 diabetes. Starvation causes high cholesterol. Root causes. Most eating disorders involve focusing too much on their weight, body shape, and food, leading to dangerous eating behaviors. The exact cause is unknown. As with other mental illnesses, there may be causes such as genetic and biology or psychological and emotional health. Certain factors may increase the risk of developing an eating disorder. I've kind of paired risk factors with causes. It could be family history. An eating disorder is significantly more likely to occur in people who have parents or siblings who have an eating disorder. Other mental health disorders. People with an eating disorder often have a history of anxiety disorder, depression, or obsessive compulsive disorder. Dieting and starvation, a strong evidence that many of the symptoms of an eating disorder are actually symptoms of starvation. Excuse me, I'm getting over a cold. Starvation and weight loss may change the way the brain works in vulnerable individuals, which may perpetuate restrictive eating behaviors and make it difficult to return to normal eating habits. And stress can also be a risk factor, whether it's heading off to college, moving, landing a new job, or a family or relationship issues can bring on stress, which can increase the risk of an eating disorder. I brought out some things that can kind of contribute to both social and physical and relate to a cause. Things to watch out for with individuals that may be at risk. Be alert for eating patterns and beliefs that may signal unhealthy behavior, as well as peer pressure that may trigger an eating disorder. Red flags for an eating disorder are skipping meals or making excuses for not eating, adopting an overly restrictive vegetarian diet, excessive focus on healthy eating, making own meals rather than eating with the family, withdrawing from social activities, persistent worry and complaining about being fat and talk of losing weight, frequent checking in the mirror for perceived flaws, repeatedly eating large amounts of sweets or high-fat foods, using a dietary supplement, laxative, or herbal product for weight loss, excessive exercise. If you notice calluses in knuckles from inducing vomiting, problems with loss of tooth enamel that may be a sign of repeated vomiting, leaving during meals to use the toilet, eating much more food in a meal or snack than is considered normal, expressing depression, disgust, shame, or guilt about eating habits, and eating in secret. I thought I'd just add those because they could be a cause to watch for. Addressing Maslow's hierarchy of needs. This one was kind of a hard one because depending on who they are having a relationship, whether it's family or friends, could be the cause of their eating disorder. So depending on the situation, some things are in both areas. For MET, you have safety, some resources for physical and psychological help. The family is supportive, a feeling of loving and belonging, a friendship of accepting relationships, esteem, respect of supporters, sense of achievement when they're accomplishing their weight goals. So they're feeling good if someone's complimenting their weight loss. Self-actualization, eventual acceptance that they have a disorder, even though it's a fight to get better. For unmet, you have physiological, from inadequate food, water, anorexia and bulimia, although some with anorexia will drink a lot of water instead of food. Sex drive decreases due to hormonal changes, and they can have menstrual cycle issues. Sleep trouble due to hunger and pains. Decreased homeostasis. And then safety, a lack of body security. Employment troubles, lack of adequate resources and funds for recovery, decreased health. The family may be a problem if they're the cause of the individual having an eating disorder. You can have property and economic hardships due to the cost of their eating disorder and decreased funds. And then the feeling of loving and belonging, depending if the friends are a bad influence and causing the eating disorder, and insecurity, or the family may be unsupportive and critical of their size. The decreased sexual intimacy for hormone imbalance also can affect their feelings of love and belonging. Esteem, low self-esteem, confidence, and sense of achievement. And self-actualization, they have a harder time problem solving with their decreased brain function. They may struggle to accept they have an eating disorder and be more prejudiced of others' looks compared to themselves. Overall, what's the anticipated function level of this population? Eating disorders are a serious and often fatal illness that it's associated with severe disturbances in people's eating behaviors and related thoughts and emotions. What does this mean in terms of likely health outcomes for individuals in this population? Eating disorders can significantly impact your body's ability to get appropriate nutrition. Eating disorders can harm the heart, digestive system, bones, teeth, and mouth, and lead to other diseases. With treatment, you can return to a healthier eating habit and sometimes reverse serious complications caused by the eating disorder. Communicable diseases and infections. People with eating disorders can suffer from bacterial infections in the GI tract. Food restriction and purging and vomiting interferes with the normal stomach emptying and digestion of the nutrients, which leads to GI problems such as constipation. And malnutrition can cause decreased infection-fighting white blood cells. What can be done to decrease this condition? Teaching and enforcing a balanced diet of food and water, and treat the physical and psychological issues affected by the eating disorder to help relieve them. And then non-communicable diseases were the most thing that you could relate to eating disorders. We have type 1 and 2 diabetes, celiac disease, Crohn's disease, arthritis, lupus, psoriasis, ulcerative colitis, and periodontal disease. Then treatment of the non-communicable diseases, which these were the most of, so take a little time. We've got the type 1 and 2 diabetes that can be managed with insulin or medications such as metformin, and healthy eating and blood sugar monitoring is important. For celiac disease, it can be managed by avoiding foods with gluten. Crohn's, medical treatment that reduces inflammation, causing signs and symptoms. You can use anti-inflammatory drugs, immune system suppressors, antibiotics, nutritional therapy. And then arthritis. The treatment focuses on relieving symptoms and improving joint function. Medications such as painkillers, anti-inflammatory drugs, counter irritants, disease-modifying anti-rheumatic drugs, biologic response modifiers, corticosteroids, physical therapies, plant spices, and surgery. For lupus, the medical treatment includes non-steroidal anti-inflammatory drugs, anti-malarial drugs, corticosteroids, immunosuppressants, biologics, avoidance of sun exposures that can cause symptoms to flare. So wear protective clothing, eat healthy, and take vitamin D and calcium supplements. Psoriasis treatment includes creams and ointments, light exposure, pills and injections. Ulcerative colitis, drug therapy and surgery, anti-inflammatory drugs, immune system suppressors, antibiotics, antidiarrheal medications, pain relievers, iron supplements, and possibly surgery to remove the entire colon and rectum. Periodontal disease. It's important to have good oral hygiene, clean the pockets around the teeth, and prevent damage to surrounding bone. Specific concerns for self-care and self-harm. People with eating disorders are significantly more likely to attempt and complete suicide than people without eating disorders. They are associated with a decreased quality of life, increased risk for depression, substance abuse, relapse, and suicide. Dieting is a risk factor for developing an eating disorder. Starvation affects the brain and influences mood changes, rigidity in thinking, anxiety, and reduction in appetite. What can be done to mitigate this harm? Antidepressants and anti-anxiety medications are often used to treat the psychological impacts of eating disorders, making sure a person with an eating disorder has less access to substance abuse items and items that a person could harm themselves with. Risk by harm to others. They often have anger management issues and impulse control problems, mood disorders, and substance abuse effects on others. Other individuals seeing those with an eating disorder may also have a distorted, unhealthy, ideal body image of diet exercise. What can be done to mitigate these problems? Seek treatment and teach and enforce a balanced diet and nutrition to decrease the mental impacts of malnutrition. Antidepressants and anti-anxiety meds are often necessary to treat the psychological effects of an eating disorder. Working with professionals in planning a healthy meal plan, diet, and exercise plan, along with enforcing and teaching that each individual is a different size and shape to decrease comparing. For body acceptance interventions, because the body dissatisfaction increases the risk for a host of other disturbances such as unhealthy dieting, negative effect, and eating disorder behavior. Putting them in a program aimed at enhancing self-esteem, self-management skills, body acceptance, health, weight control behaviors, and critical analysis of the thin ideal can also be effective. So I hope that was some good information. The rest of the slides here are my references that hopefully I put in there correctly. It's a learning process doing the APA stuff. So thank you. Bye.